Welcome, everyone. Thanks for joining us on Facebook Live. My name is Edie Yao. I am the Director of Diversity, Equity, and Inclusion for the chapter. And here with me today is Carlos Olivas III, and we're here to talk to you about facts and figures. We're going to talk to each other about facts and figures, but thank you for joining us in on the conversation.
It's a pleasure to be here.
Thank you. I'm so glad you're joining us, and I love your background promoting the Sacramento Walk to End Alzheimer's, and we'll give you a chance to talk about that.
And we're number 30 in the nation.
That's spectacular. Well, great. And once again, Carlos Olivas III and I, Edie Yao, Director of Diversity, Equity, and Inclusion, are here to talk about facts and figures today on Facebook Live. I do want to recognize that this month marks a year since the COVID-19 pandemic started, and we hope that everyone is staying safe and healthy, and we know that it's been a tough year. So thank you for hanging in there, and just know that we are here for you, the Alzheimer's Association, through our helpline, which is available 24/7 at 800-272-3900, or you can always look us up on our website at alz.org/NorCal for the Northern California chapter website. So
I like to say that one thing that I did in the beginning was call that 1-800 number. That's how I kind of got involved.
Wow, that's really great to hear, Carlos, because I think oftentimes people feel like, well, I'm managing, and I'll look for resources when I need it, and then they never find us, or they learn about us after the fact. So I'm really glad that you found us and that we were able to support you and your family. That's wonderful. So the Alzheimer's Association puts out an annual Facts and Figures report, and this year the 2021 Facts and Figures report provides what it does is it provides an in-depth look at the latest national statistics on Alzheimer's prevalence, incidence, mortality, costs of care, and impact on caregivers. The headline of this year's report is that the burden of Alzheimer's on individuals and families does continue to grow. More Americans are living with this disease. There are 6.2 million seniors age 65 plus living with Alzheimer's. And by 2050, that number is expected to more than double to 12.7 million. We also know that between the years 2000 and 2019, deaths from Alzheimer's increased by 145%. And so unfortunately, as the population ages, Alzheimer's is becoming a more common cause of death. It's also a very expensive disease. In 2020, more than 11 million Americans provided unpaid care for people with Alzheimer's or other dementias, provided an estimated 15.3 billion hours of assistance, valued at nearly $257 billion. For the first time, the accompanying special report, Race, Ethnicity, and Alzheimer's in America, actually examines perspectives and experiences of Asian, Black, Hispanic, Native, and white Americans in regard to Alzheimer's and dementia care. I just want to highlight that this is the first time we're really starting to examine the differences in race and ethnicity in regards to Alzheimer's and dementia. I need to close my door. Hang on. Sorry about that. So one of the emerging things that came out of this special report was that discrimination is in fact a barrier to Alzheimer's and dementia care. Black and Latino Californians are disproportionately impacted by dementia, facing higher prevalence rates, later diagnosis, and poor health outcomes. Women bear the burden of this disease. Almost 2/3 of all cases are female. Women provide more than 60% of all informal family caregiving. And the vast majority of low-paid frontline direct care workers are also women. So it's important to just recognize that while many people are impacted, these are some of the emerging populations that are more affected than perhaps others. The other thing that's worth noting in this report is that it reveals that non-white racial and ethnic populations expect and experience more barriers when accessing dementia care. They have less trust in medical research and are less confident that they will have access to health professionals who understand their ethnic and racial background and experiences. And we'll hear more from Carlos in just a minute about his own experience. I also want to mention that while this report did not cover the intersectionality of race, sexuality, and gender identity, it's worth noting that LGBTQ people are underrepresented in dementia services, programs, and clinical trials, and more research is certainly needed to better serve the LGBTQ community. So let's go to Carlos right now, and if you could tell us a little bit about so symptoms. When did you first notice the symptoms in your father?
Well, I guess our journey began when my dad, dentist, called expressing concerns about my dad's health. And then from there, I was able to reflect back to my dad's behavior. He was missing birthdays, special events, certain things that I guess went along with older age. He would always comment saying he was retired. He didn't need to have a watch or know what day it was. So we just thought it was just normal, but those were key signs that we overlooked because we weren't really aware to know about that type of symptoms to identify any cognitive impairment.
And once you did start to notice, that this maybe is not quite normal for your dad, how did your family go about getting a diagnosis, and what was that experience like?
Well, we called, sent a message to the doctor and said, my dad's experiencing some possible memory loss. There's certain things that just weren't right with him. Got him into a doctor, got a diagnosis of mild cognitive impairment, short-term memory loss. But from there, it wasn't really, there wasn't any like a direction of how, of like what's next. What does that mean? What is short-term memory loss? I mean, I have short-term memory loss because sometimes I can't find my keys. I think that's kind of normal
Right.
for people. So it was kind of hard to kind of understand that at first.
Yeah. Did you feel like you got what you needed from your doctor in terms of here you were presenting, here's what we're seeing, and ultimately, what did he eventually get a diagnosis, or did you have to press, or what was that like?
Yeah, he was prescribed medications from his primary care physician, and we were told that the medication may slow down a progression of short-term memory loss and mild cognitive impairment. And that kind of left us kind of in the dark because what's next? There was we didn't talk to a social worker or have any guidance into this journey that we were presented with. And it wasn't until I just pressed the primary care physician and said, I would like to escalate this to a neurologist. Let's get a referral. We got a referral, got to a neurologist. They determined that he had Alzheimer's, dementia, and that it was roughly early stage, early moderate stage. From there, we got to talk to a social worker. The social worker gave us a bunch of resources and information to kind of take on our own to look into what this disease is. But we didn't really have someone to say, sit down with us and say what this is, what is the next steps, what are we doing about this. And then from there I had to kind of learn on my own. And that's how I came across the Alzheimer's Association and getting information from them.
Thanks for sharing that, Carlos. And it sounds like you really had to be an advocate to pursue this and to get a proper diagnosis. And unfortunately, we hear that from many families, that they really have to be the ones advocating for a diagnosis and just some further testing. And one of the things that came out of this report was that, in particular, Latinos and other racial and ethnic groups find that they have those challenges that might be related to culture or language. Did you experience any of that? Like, did you feel like there were some barriers in terms of understanding your family's culture, or were there any language barriers?
Not with language, but I think there was a heavy emphasis on stigma. My dad had a stigma about this, any type of disease like this. He didn't want to go to a doctor to learn that something is wrong with him. And I think that was probably from the history dealing with my mom's disease. He was, it weighed heavy on him. So culturally, finding out about certain things is was it, I don't know how to convey it, a burden in a way.
Yeah, I think we often hear that there is a stigma still when it comes to Alzheimer's disease and other related dementia. And it's so important to inform families. It is an organic brain disease, Alzheimer's, right? It's not saying there's anything mentally wrong with the person. Nothing they did was wrong. It's an organic brain disease, and how important that is to understand. Yeah. Well, thank you, Carlos. So I want to share perhaps some of the recommendations from this report in terms of what we can do to improve some of these disparities that have emerged, or that we know of and now have sort of been reaffirmed from this report. And so some of the recommendations that the report provides is, one, preparing the workforce to care for a more racially and ethnically diverse population of older adults. I think it's in 2030, older adults of color will no longer be the minority. It will be a majority, particularly in California. And so do we have a workforce that reflects the population that we see in the communities? The other thing is to increase diversity in dementia care, from early detection to end-of-life care, taking into consideration the needs that people have, and what's culturally appropriate as well, and what do people want in terms of taking care of their loved ones. And the other piece is around engaging, recruiting, and retaining diverse populations in Alzheimer's research and clinical trials. So why is this important? Well, the experiences and views of discrimination expressed by respondents in both surveys, they also reflected their views on clinical trial participation. And the reason why it's so important that we have diversity in the representation of the subjects and the participants of research and clinical trials is that this is the only way we're going to ensure that whatever treatment comes out, that it works for both your family, Carlos, and mine. And so unless we have diversity in the makeup of those that are participating in the studies, how will we know? Because it may only work for this population and not another population, or even have adverse effects. So Carlos, I wonder, does your family, did they ever consider participating in Alzheimer's research, and why or why not?
We, I prompted my dad about it, and he said no. He didn't want to have anything to do with it. Um, yeah, I think it was because he was afraid, scared, and there was a stigma to it, because it was the Alzheimer's word kind of is a heavy word, um, for him to kind of comprehend and embrace. As for myself, um, I have participated in caregiver studies
Mm-hmm.
that specialized with Alzheimer's care. Um, so I'm willing myself to uh, um, participate in studies to kind of understand what's going on, especially to be a part of it in a diversified culture.
Mm-hmm. That's really great to hear, and I want to thank you for participating in a caregiver study. And I think that's important to know, is that not all studies are about treatment per se or about medication, that some are observational studies, and that we do in fact need lots of healthy people to participate in these studies as well, so that we can understand healthy brains to those with some form of dementia, but also caregiver studies.
Yeah,
So some of the things that we're doing at the Alzheimer's Association in these areas is we fund quite a bit of research that promotes diversity, both in the makeup of the researchers as well as the studies themselves, to look at specific populations. And so if you're ever, anyone who's listening, watching, if you're interested to see what studies are available that you may be eligible for, you can look up Trial Match, which is our online matching service to see what studies you may qualify for, and it's entirely up to you as to whether you want to participate or not. The Pointer study is another one that's in Sacramento, the US Pointer. This is one of the studies that's looking at lifestyle factors, particularly among diverse populations, to see, looking at different populations, what are some unique differences perhaps, or similarities that we can glean from that study. I want to jump into, there's so much we could talk about, but I want to make sure we cover volunteering. So certainly participating in research is an area of volunteerism in a way. And we're always looking for volunteers and need volunteers. We are a voluntary health agency, the Alzheimer's Association. And Carlos, you are a volunteer. So do you want to talk about how you are involved with us?
yeah. A few years ago, after being involved with support groups and workshops, I wanted to get involved and give back to the Alzheimer's Association because, as like an advocate role, um, I felt it was important to um, be engaged with the group. I feel that my fellow committee members are a support group in itself. I feel very connected with them. A lot of them have a connection with Alzheimer's themselves. Um, so I feel it's like a part of the path.
Mm-hmm.
And being a volunteer advocate is just it's something I'm in, kind of like a passion for me right now. More people need to know about this. We need to have backyard conversations as well with conversations with leadership in public policy. Uh, the more people know about this, the more they're going to be aware of it, and to identify early signs of Alzheimer's and dementia, especially with people of color, and especially with Latinos like myself. I think it's very important that I be a face and a voice for many of like caregivers and families that are dealing with Alzheimer's.
Yeah, that's so important, Carlos. We have a number of programs and initiatives to engage many of our communities, African American, Latino, Chinese, LGBTQ. And so often I hear people say, you know, I didn't see anyone that looked like me or that identified with. And so I wasn't sure if this was for me. And I can assure everyone that the Alzheimer's Association, we welcome all. And thank you, Carlos, for being such a vocal advocate and being visible. We need to represent all of our communities in this fight against Alzheimer's disease and other related dementia. For anyone else who's interested in volunteering or getting involved, once again, I would encourage you to check out our website at alz.org/NorCal. And you can always seek out resources, as Carlos did early on. If you have any concerns about symptoms, or you're visiting loved ones and you're worried about them, not sure where to go, call our helpline, 24/7 helpline at 800-272-3900. I should mention that we have staff online available both in English and in Spanish, and we have over 200 languages available using our language line. So please don't hesitate to call us for more support. Well, Carlos, I want to give you an opportunity to say any last words. I don't know if you want to highlight Walk to End Alzheimer's, perhaps.
Yes, yes, I do want to highlight that. Sacramento is the number 30 in the nation, especially during the pandemic. We were able to have a virtual walk and still be in the top 30 in the nation. And it's amazing, people coming out and supporting our organization. I don't have enough words to say about that. It takes a lot of work to put on such a thing, and we are always looking for volunteers to support us, no matter what part of the country you're in, or even nation. We have people from internationally that support us. You can sign up locally or nationally with your own local chapter. We encourage it. I believe this year is going to be a hybrid walk. We will be having an in-person walk as well as hybrid online. We welcome anybody and everybody.
That's right. Yeah.
Also, just to reiterate, that 1-800-272-3900 phone number is a lifesaver. I called it in the middle of the night, in despair, hurt, broken, and I was welcomed by a nice, warm, receiving person on the other end that just asked, "How can I support you?" And that made the difference. That helped me become a better person, a better caregiver, and a better son to my dad. So,
wow.
And I cannot say enough about the Alzheimer's Association, and especially the 1-800 number. It's truly a gift.
I'm so glad that the Alzheimer's Association is here to help you, and that you found us to be so supportive. So, and that you got this warm embrace from the person on the other end. So that's fantastic. Well, you see the QR code here. So if you want to help Carlos out specifically in his pursuit to raise money for the Sacramento Walk to End Alzheimer's, you can scan that. Otherwise, you can certainly go to our website and look up the nearest walk to you. We have 18 walks in Northern California and Northern Nevada alone. But I'm sure Carlos would welcome you with open arms to the Sacramento Walk. And with that, Carlos, thank you so much for joining me today for this conversation about facts and figures and sharing your personal story.
Thank you for having me. I really appreciate it.
Thank you. And I want to thank the people watching today. If you have any questions or topics that you'd like us to discuss in the future on Facebook Live, please let us know, and we're open to any suggestions. And this concludes our Facebook Live. Thanks, everyone.